I'll just take you through some of the important aspects, and we try to cover it in a couple of lectures, but everything is there in one big PDF. Okay. Okay. Now, these are general objectives for all the parasitology. So you're going to go for all parasitology. I think there are 3 or 4 dedicated lectures on that. We'll talk about the classification of parasitic infections. We'll talk about epidemiology, pretty much the same as has been saying over and over again in terms of any microbes. The most important thing for parasite, which you will find a little bit different as compared to any other microbe, is the life cycle. You got a taste of it in chlamydia. It exists in two different forms, but the reproductive cycles of parasites are more complicated than that. Okay. Now, by definition, as the word suggests, this is an organism that lives on or in a host organism that gets its food from or at the expense of its host. Pretty much the same concept as we talked about, even common English language as well, other than. So human beings can be a parasite on other. So the word as such means that you basically take advantage of your host and thrive on the food supplied by the host. Not that you need it, but that's the way the system works. In microbiology, we don't deal with industrial microbiology or veterinary microbiology, but there are people I pretty much know in the past 6, 7, 8 years that ever since we have opened this school, that some of our students did want to go in practicing pharmacy for veterinary. So, but that again is a little bit different in terms of what we teach. Our objective is human disease, especially with this part of the course. So these are some of the parasites which cause diseases in human: protozoa, helminths, and ectoparasites. So these are major parasites that we are going to discuss. Not all of them. I will just pick up a prototype, and then you can build up the whole story from there. Burden of the disease in terms of how CDC looks at it and how do we look at it, is usually seen in tropics and subtropics, and very common in underdeveloped countries, Asia and Africa. And recently, or it's been there but not paid much attention to, that it is there in developed countries as well. And again, as we recommend, and I would recommend you as your lifelong learner, is that whenever you need some information, as I was talking yesterday about STDs, well, I would believe or trust CDC. So that should be, if it's taken something in the court of law as acceptable. So CDC does have a special web page, Parasites, and you can go and find out if you need to investigate or do something about that. Okay. Now, as I said, it's so unfortunate that we don't teach it much, especially in this part of the course, because this course per se is already a very kind of compact course, which is totally different than any other courses that you would ever take from school, because we teach you immunology, bacteriology, virology, mycology, and parasitology, 5 different courses into this into one semester. So that's the challenge, unfortunately, but that's the nature of the beast. That's why a lot of cramming, a lot of things need to be done. Okay. Now, as far as incidence is concerned, you can see that the pathogenic protozoa, they actually affect more than half, or about half the population of the world. Right? So it doesn't lessen it's important. It's important, but it's complicated. Right? Even if you can imagine, I'm going to ask you to memorize a couple of life cycle, but once you do that, you'll figure out that it's tough, right? In terms of what is happening in treatment and so on and so forth. The reason being that there are many factors that play a role in terms of who will get the disease and what are the risk factors for you to get a disease. Okay. The most important thing is that three factors over here. In order for a person to have a disease, you have to have a suitable host present. So there has to be a host there for parasite to provide food. Then again, it has to be a suitable habitat present. So this could be, like I said, tropics and subtropics, because part of the reproductive cycle is going to happen in that ecosystem. And then finally, environmental conditions have to be favorable or unfavorable, so to speak, in terms of the whole disease mechanism. So these are some of the factors that you consider in terms of where the disease will be, how the disease will act, and what is going to be the outcome. How are we going to deal with that? The other important thing is that when we talked in commensalism, we talked about opportunistic bacteria. We talk about commensal bacteria in different parts of the body. If you remember, there was a Venn diagram, but you can go and see it again if you're interested. So one of them, we talked about symbiosis. So symbiosis, basically, by definition, is when two species, for the purpose of obtaining food for one or other. So that's like you're dependent on them. So they kind of do like not actually equal distribution, some kind of association where in order for you to obtain the food or for the other species to obtain the food or provide you, so like a mutual benefit. And if you remember, one of the things that we discussed in detail at the time was mutualism, commensalism, and parasitism. So don't confuse parasitism with commensalism. Having said that, I would also give you a little bit of research that the new concept is coming up. It's not there. It has not found a space in the textbook to confuse you. There may be some parasites that are there, and we are unable to decide whether we want to make them as a part of a normal commensals or not. So far, I've told you that. So far, the only thing I've told was bacterial context of bacteria. What I said that you have such set of 6-7 bacteria in different orifices and different openings of our body. Okay. Now, when we talk about parasitism, per se, what we are trying to do is that one organism benefits and the other is harmed. Because if had it not been the case, there would not be disease. Okay, so we get infection by a parasite. So parasite gets the benefit because the parasite lives, and we get the disease. Otherwise, we would not have been discussing that at all. That makes sense? Okay, so in this case, though it's a part of symbiosis, but again, it's a little bit complicated than that because one benefits, the other loses. It's just like a match. Somebody has to win. There's no draw there. Now, the harm or injury is host dependent. Again, you'll ask yourself, and I'm pretty sure by now you must have figured out host can be a newborn, an unborn, an age factor, a sex factor, a nutritional factor, a chronic disease factor. These are all factors which would play a role in terms of host. That makes sense? So host factors are important. The other important factor is that parasite load. Like we talked about infectious dose for bacteria. Some of the bacteria, I said, even one is good enough to cause disease. And then I said, for other, you need tons of bacteria to cause disease. Okay. In this case, again, that matters. So parasite load is important. Nutritional status of the host is important. And your immunological competence is important. Can you name any component of the immune system that is specifically designed to fight or off parasites. Eosinophil, okay, correct. This parasite, what else? Somebody said something. What other part of immune response is specially designed for parasite, assuming that our body knew that they're going to fight off and open up a front with parasites as well? Eosinophil, good enough, general. What specific? Say that? Complement, you said? Complement is part of that, but
MHC1?
no. IgE. Remember when we talked about IgE, we talked about going for parasites. So that again will show you an idea by nature, by design. It's not that we are prepared ahead of time to fight off or ward off or mount a defense against bacteria, viruses, and parasites as well. Okay. But remember, when I gave you a definition, I didn't say microorganism. I said organism, because some of the organisms are not micro; they're huge, like worms. Right? So you can see with the naked eye. So there's an organism there. Okay. And then again, it depends upon your immunological competence as well, depending upon your nutritional status and so on and so forth. That would decide whether you get parasitic infection or not. Now, as I said earlier, why do we care? Parasites in the United States. And again, I said that we spent 20 lectures. There are 20 lectures of immunology. There are 20 lectures for bacteriology, 10 for virology, 3 to 4. I keep on changing that for parasites. So this probably will give you an idea that it's not a major problem, but it's picking up now. It's picking up right now. And the second part is complicated. I would rather have taken another course to teach you that. But for objective for this is just to give you an idea in terms of comparative purposes, in terms of you being a health professional and taking on patients. So high frequency of all international travel. So that's these kind of logistics are changing. Not that we had people migrated over here and stayed for hundreds of years, right? Like an African American population stayed over there at the time. Probably there was no return at all, probably. But now, over time, the last 60, 70 years, there are people who are moving back and forth. So that, again, would suggest to you that things are changing in terms of high frequency, volume of international travel. Tons of people are moving in and out. The other important thing is that we deploy people for military or humanitarian missions to different parts of the world. They can bring parasites, right? And then again, immigration is still there all over the world. And finally, all our immunocompromised individuals like HIV patients and transplant patients who are chronically diseased, so to speak, may pose a risk for us to know what parasites are doing. Okay. Now, healthcare workers, like all of us, we are traveling abroad, and then again, there's a travel clinic in most of the hospital, and is covering, and this has become important now. This has become something that you have to know, you have to deal with it, but I would assume not on a daily basis. That's what we call burden. So the burden, as I said yesterday, for STD was in $3-4 billion on government to take care of that, as compared to burden over here, which is more on WHO or the World Health Organization as compared to US alone. But things are changing as we go. Okay, remind me later. All right. Okay. Now, when we talk about parasite classifications, as I said earlier, just to give you an idea, protozoa, helminths, and ectoparasites. When we talk about protozoa, we talk about malaria, giardiasis, amoebiasis, and cryptosporidium. So these are four classical, these are not the only, for four classical diseases that we deal with it. And people, especially in this part of the world, Malaria is a notifiable disease, right? But people coming from Asia and Africa, for them, if you ask them, they will tell you that their moms will say, oh, my son have had malaria for this year. So it was like they have to have a malaria every year. It was so common. And even if people coming from, if you ask them how many bouts of malaria you had in a lifetime, they don't even count. It's so common a thing over there. But again, if you were to travel there, you are at a very high risk. So malaria is a big, big project over here, over in the world. Giardia, we have amoebiasis, we have Cryptosporidium. I'm going to touch upon that. Helminths, again, are the worms. And there are different type of worms. I'm going to discuss the whole immune response. We talk about parasitic immunology as well, so you should be a little bit familiar with that, especially with the cuticle of these parasites. Strongyloides, enterobiasis, and cysticercosis, these are the three important. And as far as ectoparasites are concerned, lice and scabies are also here. And interestingly enough, we don't teach you, but the CDC also consider these two as STDs. So there are always chances for people to acquire these two infestations from sexual contact. So these are the major classification. But if you look at the sizes, for example, in this case, you look at the red blood cell, they are infected with malaria parasite. Who did project on Plasmodium malaria? Plasmodium malaria? Nobody did. I thought it was an important topic. I gave it to someone. Or maybe this really is not present today. So malaria is a big problem here because of mosquitoes. And you can see they are going to infect the red blood cell. And again, they are huge organisms. And if you look at the ectoparasites, so these are, you said, all this anti-lice shampoo, especially for the school-going kids, outbreaks, and so on and so forth, is pretty much common out there. But these two things, you will see quite a few over-the-counter medicine available. So let's begin with the first one. And the overview for the whole diseases, like a group, is that these are microscopic. So these are microscopic as compared to worms. They are like, you can see that here, huge. They are one-celled organism. We do include them as parasites, but they could be free living as well. So this means they have capability to survive on their own. Okay. So there are four major groups that infect human beings, and we categorize them for our ease, or maybe classically in the past, we still want to use the same classification, is based upon their motility. How can they move? You can see these are the important Sarcodina, which includes amoeba, Mastigophora flagellates, Ciliophora had ciliates, and Sporozoa, which is non-mortal adult stage. So these are the four important categories of protozoa which are going to infect us and cause disease. The other important thing is that they have an ability to transmit disease from human to human. Okay? In this case, if there happen to be gastrointestinal pathogens, like amoeba, for example, so they can be transmitted to the other, like fecal route. So if you don't wash your hands, or people working in the food industry and so on and so forth, so that kind of a cycle will be completed. Or water unfit for human consumption. So all those hygienic and sanitary conditions, if they're compromised in any parts in food industry or in the school, so on and so forth, it can be transmitted from human to human. But for the blood-borne protozoa, like malaria, they have to have a carrier. So you have to carry through mosquitoes. So mosquito is going to bite one person, draw the blood out, and take that plasmodium and inject it to the other. So which is vector. So we have a vector which in this case is arthropod mosquito. Like lice can play a vector. There are a lot of other vectors that can jump. Fleas can become a vector. So the whole idea is that they will draw blood from you and inject it to the other, as bad as a injection, what you call a needle prick injury. That's pretty much it. Okay, so these are also called blood-borne pathogens. And then again, some of the blood-borne pathogens can also be transmitted. We talked about that in hepatitis B or HIV also, which are indirectly. HIV is directly STD, but hepatitis B can be acquired through that sexual contact. Okay. Now, as I said earlier, more than 3 billion population is affected. The diseases are worldwide, but just to limit ourselves, constraints of our time and the course content, we would want you to know these diseases in the United States: malaria, giardiasis, rabies, Chagas disease, toxoplasmosis, and trichomoniasis. Trichomoniasis, again, is an STD. So trichomoniasis vaginalis, we'll discuss that probably in some of the content. But these are 1, 2, 3, 4, 5, 6 that I want you to be aware of, and I want you to know some of the basic, those 5 objective modules for all of these. Okay, so today we'll just start with the first one, malaria. That happens to be the most common parasitic infection worldwide. Okay. There are 2 terms that we normally use: morbidity and mortality. Morbidity means how sick you are, how ill you are, right? How morbid you are. And mortality, if you die because of that morbidity. So these are 2 different terms. So a disease may have a high morbidity and high mortality. In this case, you can see from here, for malaria, both. So if most of the statistics, you can go and look it up. They keep on changing. WHO means that there are more than 200 million cases, clinical cases worldwide. Okay, but we do see, you can see if you look at the burden that we have in US. Again, keep in mind that people can bring it up from other countries back and forth. So many times the physician would inquire, did you travel abroad? Because if you have a high fever with chills rigors, right? So there's a very common question asked because of the amount of parasitic infection that these people can bring into this part of the world. And also keep in mind that more than 500,000 will die for that. So this also will suggest to you that we still are struggling. There's no vaccine, right, as of now for malaria. And there's a big project working on that. We are being challenged to find out a cure. What happens in this part of the world, if somebody was to die of malaria in this part of the world, generally because he or she was not diagnosed properly and was not treated. We also keep in mind that malaria can be cerebral as well. So you have cerebral malaria, and guess if you're not diagnosed. I remember of a story. This was one of my friends. He came back to, he was doing residency in Brooklyn, in New York, and he had a high-grade fever with chills and rigors. And they would do all the tests and everything, and nothing was bringing his fever down. And then all of a sudden, they thought that he just came from Asia, from India. And then he said, you know what, he maybe malaria, but there are no tests available. So they requested the pharmacist to give the chloroquine just to try. The moment they gave the chloroquine, fever immediately came down. But then there was a big issue because it's a notifiable disease, right? And normally they don't keep it. They have to make sure they tell the public health organization. So things of that nature, if a person working as a physician in a hospital and he gets neglected because his fever is not linked to malaria, let alone a little baby, for example, a pregnant woman. So these kind of things happen. to bring mortality high in this part of the world. So that's what we say, that always ask this question, and that have you traveled abroad? So that has become very rote because we kind of screen you for all the diseases. And again, you can see, does anyone know what is that? What does this, say it again? Louder. Say it again? These are red blood cells, okay. But what's specific for this one? Sickle cell. So what's going to happen? Because sickle cell is a very high incidence African American population. Does anybody know what's the incidence of sickle cell anemia? 1 in 400, very high. I remember one of our students died in physiology of sickle cell, young girl, 1 in 400. If you cells are already sickle shaped and you get infected with malaria, that's a death sentence. Because oxygen carrying them, problems compromised. So that's a very serious problem if a sickle cell person gets malaria. Is that point? So you are right. These are red blood cell and then sickle cell. And again, mosquito there. Okay, now people are traveling to areas all over the world where malaria is endemic. And the advice is that if you do travel, even for going to Caribbean or any part of the world, or, you need to check travel advisory. You need to be visiting travelers clinic to be sure that you are covered for that, because travelers, immigrants are bringing, and then again, the other problem is that bloods, that if you're a blood donor, they would test the blood before they transfuse it for all these kind of nasty microorganisms, because that again poses a problem. Pathogenesis, again, remember the same sequence, the physiology of the microorganism, we need to epidemiology of that, and pathogenesis, clinical treatment, and then prevention. So we'll try to stick to the same kind of rubric. Okay. Causative organisms are Plasmodium species. So malaria is caused by Plasmodium species. These are all Plasmodium species. The most important are Falciparum, Vivax, Ovale, and Malariae. 1, 2, 3, 4 of them are important. And especially malaria is transmitted by female Anopheles mosquito. And then remember, for prevention as well, you have to have mosquito nets and all these kind of things, and you're going to work on. But the problem is, in one geographical area in Asia, for example, like 100 square meter, there are more than 4,000 different species of mosquitoes. So you see our problems in terms of coming up with a problem in terms of prevention. But we know for sure that this is transmitted by an infected female Anopheles mosquito species. And that again is a common question, as just you need to know that. Okay, now that's where the problems now begin. And if you can go to CDC parasite, you see tons of them. They will just put the burden on you of knowing whatever is there in these presentations. But you may want to spend a lot of time over here, try to understand. And they are available. It may not be very obvious over here. And I don't intend to kind of teach you in detail, but the point over here is that all these parasites have a life cycle. And what you need to find out over here as well, if you pay attention, that they are in different in terms of infective stage and in terms of diagnostic stage. So we have a challenge. Sometimes you are infected, but we cannot diagnose you. Okay. The other important thing you have to keep in mind is that some of these may have 2 different types of reproductive cycle, which part of it is asexual and the other is asexual. So these are 2 different kind of things that they go through. And again, you will see from here in this case, the most important thing, let's begin from anywhere. That, for example, let me see how I can go from here to expand that. Okay, maybe that. All right. So if you see over here, let's see number one. So see, say mosquito takes a blood meal, so injects sporozoites to you. So that's the number one stage of the beginning of the life cycle. So you just have a mosquito bite over here, right? And that injects sporozoites in the blood, and then they are taken to the liver cell. So you can see the important thing, there's a time involved, and there are different types of stages that we need to go through. Okay, so that's, and then from here, the very first stage will be human liver stage. So the moment you get this mosquito bite, malaria, the very first stage is going to go for the liver, right? It's going to infect the liver, right? And then all those cycle, the first cycle it goes through is in the liver. But remember, I told you that malaria parasite infects what cell? Huh? Red blood cell. We just said red blood cell, right? So we know for sure. So what we are going to do right now is that we're going to cause any other life that this microorganism live as exoerythrocytic cycle. So this means that this cycle is being completed outside the red blood cell. Okay? And if I was to ask you, where is this exoerythrocytic cycle taking place? And the answer is liver, right? So you can see it goes infect liver cell, and then in the liver cell, sporozoites change into schizont. So they are schizont or schizont, whichever way you want to pronounce them, right? And then they will multiply over here. You see, it's just one sporozoa. They keep on dividing and they multiply, and then they will rupture. So you have the big schizont over here, and then again, it's taking a cycle. It's taking a time. Those of you who have had malaria, those of you who have seen the patient, their fever goes to a cyclic nature. It goes up and down. The timings of the day. That's because of the nature of the cycle. Okay. So 1, 2, 3, and also keep in mind that why do we need to know that? Because we need to stop. We have to stop this kind of activity, right? Because as I said earlier, parasites are mortal. They move, and by the time you reach out to them, they move somewhere else. So you can see from here. So once they are ruptured, then we go for the human blood stages. Okay. Common understanding: you get a mosquito bite, it's going to go into the blood, right? But it's not going to go into the red blood cell. It's going to go to the liver. Then once the schizont breaks, then it will go and infect the cells, and you can see the erythrocytic stage, and that's what we'll see, immature trophocyte. And if you pay attention over here, I don't know whether I mentioned it or not. Let me go back a little bit. Okay, so you will see there were two triangles there I showed in the beginning: infective stage and diagnostic stage, right? So sometimes you are infected, but we cannot find it out. There's no test for you. But now, when it goes to blood or erythrocyte stage, then you see D. So this means now we have means to diagnose them. And remember, I told you the problem people die because they're not properly diagnosed, right? And fever is most complicated symptom that you have. There are thousands of causes of fever. And if you don't find a cause of fever, what do we do? If you don't find a cause of fever, so what do the physicians do? They would do it in the very first place, not in the end. You don't even need a pharmacist Tylenol. They would label it pyrexia of unknown origin, PUO. That's what they would do. And this is their. So the point is that there are causes of fever unknown to us even medical people. Pyrexia or fever of unknown origin. We'll discuss that later as a part of clinical thing. But anyway, so you can see from here, it goes to immature trophocyte, becomes a mature trophocyte, and then again, you will see that two different pathways come from here. One is going to go to gametocyte, and other will again go to the schizont, and then this cycle of schizont in terms of dividing and going back and forth over and over. This is a cyclic in nature that will keep on happening uncontrolled if you don't go and interrupt. So there needs to be some medicine which is going to target this particular cycle. The other problem with this one is that when it goes to gametocytes, like in number 7, again, it will, the way the gametocyte suggests to you a sexual content over there. We say male and female gametocytes. Because gametocytes are gametes like sperm and eggs. So you can see that they have a, so to speak, an asexual and then a sexual cycle, gametophytes, where we will have a male and female gametocytes. And that also is a diagnostic thing. So what we normally see is that most of the time, especially for Plasmodium falciparum, we basically will see both of them, and same goes for the other as well. But then again, these are these gametocytes that are there in blood, and you will be bitten by another mosquito, and this mosquito will draw blood out of you in terms of gametocyte and give it to other. So this is a continuous cycle that goes on. Just keep in mind, in those endemic areas where there is mosquito, because you can treat a person, but what are you going to do with mosquitoes? There's no place like mosquito-free place. You know, even if you go for, and then also keep in mind that many a times, I'm not going to talk much about that, that these mosquitoes which cause disease are the mosquitoes which are living on clean water. Clean water. It's not like, you know, those kind of garbage places that mosquitoes are hovering around, but these are the clean water. So then again, this will go to another cycle that you can see mosquitoes. The other important thing that you can see, what we call over here, let me see if I can decrease a little bit. We call that a sporogonic cycle over here. Again, in this case, what happens is that they complete part of their cycle, which is outside or within the mosquito. So you can see from here that they are going a part of it into the system where they will go to, especially the gametophyte stage, where you can see the word okinete and oocyst and sporocytes. So these are again another cycle. So 3 major cycles are taking place. One is a sporogonic cycle, one is a erythrocytic cycle, one is an exoerythric cycle. So you can see the complexity of the problem, and you can also see what is it that we need to do in terms of the treatment that we have to devise in terms of malaria. Okay, so these are important life cycles for almost all the parasites that you will see, and they are available in detail. And again, as I said, that maybe I would leave it on you to kind of figure it out and do it over and over again till you get the concept. Because if you don't get a concept and we treat you anti-malarial drug, and I tell you that this is going to affect sporogonic cycle, and you will have no clue what is this he's talking about. Or he's going to talk about the human blood stages or human liver stages as compared to the mosquito stages. So all you need to know over here, some of the stages, especially sexual, are taking place within this mosquito. Okay? And but if you pay attention over here, you will see that some of them are not infective. So you can see from here, we would not have problem with other life cycle other than the sporocytes over here. So these are the ones that kind of initiate the cycle. The rest of the cycle is human, and then the mosquito. So part of. So again, the problem will come that how can we stop? the cycle that takes place in particular species of mosquito. So you can see the complexities of this particular parasite. It by far is more complex than simple. So bacteria would look to you very simple now, and viruses will be very simple as compared to parasite, which happen to tons of different cycles that they go through. Okay. Now, what are the human factors? I said there are host factors that are going to affect you, and we just talked about the sickle cell trait. We talked about the sickle cell again, and there are some other things that you have to have. There are different blood groups. We teach you ABO, and major blood group that have a major reaction, but there are other blood groups as well. One of the antigen is Duffy blood group. If you have that, then again, you have a higher propensity of getting infected with malaria. Immunity, again, you can see we are still talking about that. Is a passive immunity. There are multiple infections. So this doesn't mean that if you had malaria this year, you won't have malaria next year. Right? So that's good for viruses because we get an antibody response. So these are some of the inherent problems that we are struggling with. We do care for pregnancy because there is increased susceptibility and there's a risk to fetus as well. So there's a intrauterine death and lot of kind of not only morbidity but mortality of pregnant women getting malaria infections is very high. And then again, also keep in mind that if you were to give them drugs, so these drugs are going to go with such a complicated life cycles of this microorganism. It's not like just target RNA, target DNA, target this cell wall, because they are they are running around. They are at loose, and they're hiding. You can't even diagnose them. So these are the complexities, especially for the malaria. And one of the biggest project that WHO has is on malaria. Now, one of the things when we talk of malaria, again, we can do prophylaxis, of course, as I just said, before you go over there, because I need to go. It's not, if there's a malaria there, I'm not going to go back home. But you do prophylactic measures, so it is indicated for travelers. And there are many things that are there in terms of people who are, you can see from this is red is a high risk area, and that includes Africa, part of Central America, India, Far East, very, very high kind of prevalence of this particular disease. You travel over there, they're going to tell you exactly, what is it that you need to take. You have to make up your choices whether you're going to go for that. So it's sometime, but there's, especially for malaria, there's no vaccine. So what you need to do is that you want to make sure that you take that medication. Now, when we talk about prophylaxis, that's your role as well as a pharmacist, is that if they're going to ask you what is the best prophylaxis medicine to use, they can always ask you. You have to say it depends. What you need to do is that you have to find out how you're going to stick to this compliance in terms of, because I remember when I traveled, so I had to go for like different, in Asia, China, different places. So it was like probably last year, about 6 weeks or more. So they made me eat like one tablet every day. Start 1 week in advance, keep taking it every day, and come back and take it for the 2 weeks. 2 months, I mean, it's not easy. Especially if you have like distaste and side effects, but then you have a trade-off. You get malaria or you get this side effect. This is important, okay? That also depends, they're going to ask you how long you're going to stay over there. Especially I remember when I landed in China, so they wanted to see the malaria kind of thing, because the governments are also scared because you want to bring something. So you are taking this medicine. They were worried about typhoid as well, okay? So that's important. But again, I can advise you that there are tables for each and every country, and there are recommendations for CDC, what needs to be done, and there is a World area map. You're going to spot, I'm not going to ask you other than I just told you, is Central America, is Central Africa, and India. These are the three major, that's a red zone area where if you would travel, not that the others are not, but these are like in terms of the color that we talk, in terms of the disease that they normally get. When we talk of the presentation of these people, as said, typical is fever and malaise. People we see as fever in this part of the world, duration of fever depends. And then again, as we talked over here, a very serious form of disease is called black water fever. If I was to ask you what causes black water fever and give you all the 4 different species of plasmodium, so make sure that you know it's falciparum. And as we discussed in the life cycle, erythrocytic phase causes death of cells. That's where the problems are coming. So you have high fever, you have sweating, then again, sometime you may have drowsiness, and all typical symptoms. These people may also present with anemia because the red cells are killed, and they may have enlarged spleen because spleen kind of filters the what you call red blood cells, and if they are infected, they're going to be in different sizes and shapes, and they're going to get clogged. So this is a clinical presentation of malaria that we know. How do we diagnose it? Again, as I said, depends upon the state that we have to hit. The gold standard is called thick and thin blood smear. So you have to obtain smear for 12 to 24 hours, at least 3 days, and then again make sure that you look for it. It says over here, trained eye is required to see the infection. You really can see over here. And those of you who are interested, I think there's a very good movie on that as well. And again, this is what I was trying to emphasize upon you, and it's a good slide for you to see vivax, oral, malaria, and falciparum, that they come in different stages. They can come in different stages, and we really have to go after them depending upon which part of the clinical cycle you hit and what is the medicine you're going to take to treat that. But you can see from here that we take the blood smear from each of them and we look for particular area. So these are very diagnostic kind of a thing, a typical thick and thin blood smear, and look for a particular type depending upon the morphology of that particular, either is gamete or sporocytes. Finally, as far as treatment is concerned, again, this is a CDC guidelines available. The most important thing is that you have to take medication and you have to give a supportive care if needed. The goals of the therapy per se is that you really have to act fast. You have to make sure that you miss the train or miss the flight, so to speak. So it has to be rapid diagnosis and medication initiation. And the whole idea, you have to get rid of infection within 3 days, right? So that it doesn't lead to any complication. And the complication that will kill the patients are hypoglycemia, pulmonary edema, and renal failure. So these come very fast. They come very fast. You don't want to miss that. You want to make sure that you go after that, okay? And then there are some other treatment options available in terms of you can see the patients who have people like HIV patient or is a chronic ill patient. So we have to deal them accordingly. So if you are on prophylaxis, then we can basically take you in different ways. So if you, for example, are HIV patient traveling to those area, if you are pregnant traveling to those area, so there could be different type of advices that we can give to you in these cases, right? And this is one of the questions that I'm not gonna leave it on you. These are the choices available. So these are the drugs of choices available. Maybe you can see over here that there are chloroquine compounds, and this is a typical thing that some of them are IV, some of them are oral. Okay, so I'll just stop here because